I'm Sarah Smith. My social marketing campaign proposal is on veteran identification, a responsible way to identify veterans at risk for PTSD. Due to military experiences and deployments, veterans are at an increased risk for post-traumatic stress disorder, making them more susceptible to experiencing emergence delirium or anesthesia delirium. It's a combative way of waking up from anesthesia. It can be traumatizing for the veteran patient and provider or provider clinician. So it involves reliving a hostile experience, triggering extreme stress, anxiety, and or nightmares. Veterans can seek care for mental health needs more readily now due to the Mission Act. Through the Veterans Health Administration. It was put into place in 2018, and it now allows eligible veterans to seek care through civilian providers at the cost of the VA. So what does that mean for civilian hospital providers and clinicians? And when I say clinicians, I mean non-nurses. Physicians are the providers. This means that they could potentially see an increase in the number of veteran patients visiting civilian hospitals. So civilian providers, nurses, clinicians need to know who these patients are. And it's important to mention, it's not to be assumed that all veterans will experience anesthesia delirium, nor do all veteran patients have PTSD, as Corps' years of experience and missions differ greatly. For example, my mission as a United States Air Force Reserve medic is completely different from a frontline Marine. One of my real world missions I got to support was transporting troops from Baghdad, Kuwait, and Fallujah. But again, that's going to be very different. It's going to be different for versus a 2-year Army veteran who spends his enlistment shuttling foreign dignitaries, as opposed to a Vietnam vet that serves body security detail, meaning job, moving lifeless bodies out of a country. So the bottom line is the purpose of the campaign is that civilian providers, clinicians, nurses, they need to ask, have you served? And this campaign was to devote our focus to educating registered nurses from non-VA hospitals in the state of West Virginia on the importance of veteran identification. So 2 previous campaigns were looked at as a provide a backbone for this proposed campaign. Joining Forces campaign, launched in 2011 by Dr. Jill Biden and former First Lady Michelle Obama. It was to increase education efforts towards providers on healthcare needs of veterans and those supporting vets. And then in 2015, the American Academy of Nursing initiated the Have You Served in the Military campaign, and it was to increase the number of patients asked if they have served as a way to individualize nursing assessment. So we took that one step further as a way to, we wanted to reach a specific audience to increase veteran identification and asking additional questions. Have you served? What Corps? Have you seen combat? Do you seek care at the VA? And then an additional step in veteran identification using a magnet, which I'll talk about later. So target audience was very specific: registered nurses who work in civilian hospitals in the state of West Virginia, because right now West Virginia is one of the only states that requires 2 hours of continuing education credit for registered nurses on the care of a veteran. I think Connecticut's the only other state. It was compared to other audience of providers, clinicians that are not mandated to receive that additional education, so they may not have feel as compelled to be engaged in the social marketing campaign or the events that we're going to offer through the campaign. And then lastly, looking at nurses, providers, clinicians who practice in the VA, identification of veterans is already a normalized environment, and then they use screening tools already, routinely use screening tools. So maybe another future campaign would include that group, so that non-VHA nurses could learn from the VHA nurses. Just a forward thinking there. Marketing strategy. So as far as the actual and augmented products, include tangible goods and services that the campaign will offer, and additional services that the campaign will provide to assist the nurses in behavior modification. So getting them to ask those questions that I mentioned earlier. And then an additional step would be teaching them how to use a magnet, learning how to identify the veteran using a red, white, and blue magnet to place outside the patient's door if the patient desired. And then, so that would be the tangible good and service. And then augmented goods and services would include training sessions, media coverage, and evaluations. So train the trainer events or conferences would be organized and offered to civilian hospital point people. Then they would take that information back to their hospitals, to the bedside nurse, and teach them on the importance of veteran identification. A number of allotted magnets would be handed out to those who attended the conference or trainer events. And then, of course, continuing education credits would be offered there as well. We would provide lectures with case study-like examples of various roles, missions, and deployments that veterans have experienced and why they're susceptible to PTSD. And then guest veteran speakers could share their experiences in civilian healthcare. We would have a mingle of veterans and nurses, get them engaged in different groups to learn a little bit more about each other, learn about the military culture and military ethos, as they do not want to share a whole lot about why they may have ended up in the hospital. You're taught from the very beginning, as like, your people are on a need to know basis. So there's a lot of mistrust there. Local newspaper and television stations would be attending the event and sharing coverage. And then, of course, they're going to be able to plug those into social media accounts to share information there as well. And then as far as delivering our message of nurses' mission and duty, identifying if your patient is a veteran, gains them access to veteran support groups and mental health services. To push that message forward, we would use the Vet to Vet group, or a group like Vet to Vet, which is a group of prior service volunteers who visit the patient after the nurse has identified if the patient was a veteran. And I'm going to go ahead and share my screen. So this is another way to deliver the message. Maybe we could have a video of a nurse identifying the patient using those questions, and then the magnet and explaining why veteran identification is important, part of the care that he or she will provide. And then the nurse would go on to talk about additional resources that are available to the patient. This video could be shared in multiple capacities. I'm thinking about YouTube just as an example. But overall, the veteran identification and is actually something that's in place right now at some of the hospitals, all the hospitals within the system of WVU medicine. So I use this assignment as a learning experience on ideas as how we can market our program and the importance of veteran identification, because those questions don't always get answered and nurses don't understand the reason why we need to ask those questions. So Vet to Vet was founded by Dr. Gina Mayako. She's shown there in the lab coat, and she has a copyright on the magnet. We haven't used it yet just due to funding and cost, and we're trying to identify all those challenges. So I've learned a lot just brainstorming from this class. Also, you'll see us visiting the veteran patients, and then we've had some pet therapy dogs join us. We partner with Operation Welcome Home, Hearts of Gold, the Vet Center, and WVU Veteran Group, and I believe we started in 2017. So a quick story, I know I'm cutting into time. Peppy, short for pepperoni, is the little Jack Russell that I'm holding there. That was actually my brother's dog. He was prior service Afghanistan paratrooper who passed due to PTSD, TBI, complications of those. So my mom had him trained to be a therapy dog, and he would go with us on our vet visits. So military members and veterans are mission-driven individuals, and our mission for this campaign was clearly marked. We want nurses in civilian hospitals to see veteran identification as a responsible way to identify patients at risk for PTSD, becoming combative with certain medications, and to identify those in need of additional veteran support groups and/or mental health services, because the nurse can't do it alone. And we have those experiences that we can relate to, and vets will open up to us, vet to vet. Thank you.